Good morning. I'm Colonel Ingrid Ford, the Command Surgeon for Space Command. Thank you for the introduction. It's my distinct pleasure to be here with you today and discuss why we need to deliberately plan for the delivery of surgery in space. My background, I'm a nurse by trade. I've been in the military for 27 years with a background in med-surg, ER, and aeromedical evacuation. However, for the last 10 years, I found myself in leadership and administrative positions to include, for those military in the room, squadron command, group command, running a hospital in Japan at Yokota Air Base. And then as a command surgeon, this is my third command surgeon position, which is definitely a very unique and challenging position. I've been in Colorado Springs for about a year and a half, and so learning a great deal about space. I'd like to also introduce my deputy, Lieutenant Colonel Melissa Runge, who is a physician by trade with a background in family health, ER, and aerospace medicine. To set the stage, I'd like to provide a big picture statement, the so what, regarding surgical implications in space. As space programs progress, there will be a call for DoD and NASA to expand their domain. As human beings go forth, they'll need appropriate medical care during a long-duration spaceflight far beyond the International Space Station that does not currently exist today. I have no conflicts of interest. I'll first provide you some information about United States Space Command, including how our mission is involved with human spaceflight support. Then we'll touch on some historical examples of medical research in space, followed by more recent terrestrial research to better understand microgravity. Lastly, I'll briefly touch on some challenges we'll need to consider as we plan for planetary exploration. So as a combatant command, I know there's a lot of civilian personnel in the room, maybe are not that familiar with the military structures, but as a combatant command, United States Space Command conducts operations in, from, and to space to deter conflict and, if necessary, defeat aggression, deliver space combat power for the joint force, and defend U.S. vital interests with allies and partners. So we're kind of the military combat arm for space. You'll see U.S. Space Command listed under the Unified Combatant Commands. So over on the right there with the red arrow, U.S. Space Command was established as the 11th Combatant Command in 2019, so relatively new, just 2 years old, with an area of responsibility of 100 kilometers above sea level. So that's a huge space, obviously. Our commander is General James Dickinson. He's a 4-star Army general who leads approximately 1,400 personnel in a joint environment. So we have Army, Air Force, Navy, Marines, who all work together at our headquarters in Colorado Springs. I wanted to touch on our service components. United States Space Command has a service component for every branch of service. As I said, we're joint, and so you can see that across the top. You can see on the slide the specific Space Command mission sets for each, and of note, the human spaceflight mission falls under 1st Air Force, the one that's circled there in red there. And so we work heavily with 1st Air Force in that role, but also with all these other areas, more and more. Human spaceflight support falls under the purview of a single unit in the Department of Defense known as Detachment 3, and that's at Patrick Space Force Base in Florida. The unit was first chartered back in 1958 as the DoD Mercury Support Office, and more than 60 years later, still supports all current and future NASA crewed missions. They coordinate contingency support and train and prepare DoD personnel worldwide to support our nation's crewed space programs. So what's my role? My role as the command surgeon is first and foremost all things medical to support our Commander General Dickinson. Even though our area of responsibility is space, as we all know, we don't currently have any medical treatment facilities or hospitals out in space yet. My office has an important responsibility, though, to establish medical operations as we increase human spaceflight, which includes partnering with commercial and interagency partners. So let's talk next about those other organizations that I work very closely with. So NASA is the first organization. We have those three primary players in U.S. space exploration, each with different missions. NASA as an independent agency of the U.S. federal government whose primary goal is exploration and research. Next, private industry, which everyone's heard of, Blue Origin, SpaceX, Virgin Galactic, and so they're obviously looking towards commercialization of space. And then the Department of Defense, where I belong, where we have to look at always the same things. And so all of these organizations have really one primary focus, and we all are looking at the same objective in mind, and that's transitioning humans into space safely. That goal drives the development of standardization for medical care. This is the basis for why we need to consider surgery in space. So next we'll focus specifically on NASA. There are three main human spaceflight support programs out of NASA that I work very closely with. This is probably my main effort. Of note, the shuttle was used for transportation to space from 1981 to 2011, and everyone's familiar with the shuttle program. So the three programs I'll touch on, first is Soyuz. So between 2011, the retirement of the space shuttle, and the 2020 demo flight of the SpaceX Crew Dragon, the Soyuz, so the Russian spacecraft that launches and lands back at Kazakhstan, served as the only means to ferry U.S. NASA astronauts to the International Space Station. The DoD supports air medical evacuation of the U.S. astronauts when they land in Kazakhstan, if and only if acute critical care requirements are needed. Next, commercial crew. So the first flight of the commercial crew program was the launch of the SpaceX Crew 1 on 16 November of 2020, so not that long ago. Next month will be the launch of Crew 4, followed by the return of Crew 3. Lieutenant Colonel Runge, my deputy here, was the DoD flight surgeon at the SOC, the Operations Center down at Patrick, for the Crew 3 launch back in November of 21, which is pretty cool. And she'll also serve as the DoD surgeon for the launch of Crew 4 that's coming up shortly. Det 3 is tasked with all contingency rescue and launch and landing for all of those missions. And then lastly, Artemis, which everyone's hearing a lot about in the news, is the NASA lunar mission, and Det 3 is again tasked with contingency operations and capsule retrieval. So with all these missions, how much has medical been involved in actual spaceflight? So not that much, right? So there's been about 600 humans from the United States that have been to space. But there's only been 46 medical personnel, and then you'll see the breakdown there up on the slide, 44 of which were physicians. So as the DoD and NASA programs continue to grow, there will be a greater requirement and need for medical professionals who understand space medicine are capable of providing medical care in space. Although historically very healthy people have gone into space, there are multiple variables that may contribute to medical issues, to include physiological changes, illness, and trauma, as we look towards long-duration spaceflight, up to 3 years in space. Medical experiments have been conducted in space since the first space station back in 1973. So that leads me to the Skylab. So the historical background was about studying medicine in space back in 1973, where things kind of started. Skylab was the first and only U.S. space station launched by NASA. The focus was on science and medical experiments focused on behavioral, neuropsychology, nutrition, musculoskeletal, pulmonary, cardiovascular, and hematology studies. It took about 15 years between the Skylab program and the shuttle program to reinitiate a dedicated commitment to medical research and real-time medical capabilities in space. Here's an example of a medical experiment accomplished on the shuttle. You'll see the picture, this is the first cardiologist in space, Dr. Drew Gaffney. A Swan-Ganz catheter was inserted in Dr. Gaffney's arm prior to launch to monitor cardiovascular changes and fluid shifts prior to ascent. The catheter was removed 4 hours after reaching orbit, so he's pretty brave being the first one to allow that to happen to him. Data revealed the blood pressure rise on the launch pad, which increased sharply and peaked during ascent, then steadily returned to normal after a few minutes in space. So this data refuted earlier suggestions that a rise in blood pressure from fluid shifting in the upper body was a result of weightlessness. So the diagram that's populating right now shows data gathered from limited human and animal studies, because there really hasn't been that much, as previously discussed about Skylab and the shuttle research, reflects the following metabolic changes in microgravity that are listed there. So known physiological alterations include fluid redistribution, cardiovascular changes, bone and muscle atrophy, and the effects of ionizing radiation, just to list a few. So I'll move on to the next slide, which is more of the interest of this audience, and that's, gastrointestinal changes. So I'll just touch on that next. This is basically an overview of the changes of the digestive system that are affected by the microgravity environment. Every aspect of the GI system will be affected by microgravity. So how will symptoms present in this microgravity environment? And so, of course, we have that more short duration space flight that's occurred up till now, but we are thinking long term what will happen as people are in space for longer periods of time. So we collaborate heavily with NASA, and they have done a lot of research also on physiological changes of microgravity. So next we'll discuss some of the terrestrial research which leads to a better understanding of the challenges of surgery in space. You're all obviously aware that there's oftentimes acute emergencies for appendicitis or cholecystitis that require immediate surgical intervention. And so looking at those possible surgical emergencies when you have long duration space flight shows an obvious need for advanced onboard diagnostics and treatment for those types of obvious emergencies. So I'll touch on parabolic flight. So what is it? It's a gateway to weightlessness. And so it reproduces gravity-free conditions in an aircraft by alternating upward and downward arcs that are interspersed with leveling of flight. It provides a microgravity environment for scientists to conduct research without going into space, actually. This particular slide visually demonstrates the different gravitational properties on Earth, Moon, and the Mars. There's a fourth element, and that's the black area, which obviously represents space at zero gravity. There are 4 distinct environments that demand 4 different considerations regarding potential medical care and surgery. This needs to be considered when planning for experiments and eventually missions that may involve invasive treatment. The KC-135, which I flew on extensively for AirVac, and they also, for this purpose, they call it, is known as the vomit comet, with the maneuvers that they had to do to perform to these experiments in the air. It was introduced in 1957 when astronauts began training in this parabolic flight environment. It's a modified aircraft capable of accommodating high Gs and zero G flight profiles repeatedly. The micro-G environment lasts for approximately 20 to 25 seconds, providing a very short window to conduct experiments. Listed here are some of the training profiles and procedures performed by physicians, and in the pictures you'll see some of the training stations, to include Dr. Jennings and Campbell performing a laparoscopic surgical procedure during zero G on a live tissue model, which Dr. Jones touched on as well. And then as well as telerobotics on the KC-135 during parabolic flight. Survival surgery was performed for the first time on rats during the STS-90 Neurolab shuttle mission in 1998. A craniotomy, leg dissection, thoracotomy, laminectomy, and laparotomy were performed as part of physiological investigations. The conclusions were that technically demanding dissections could be accomplished successfully in space on rats, suggesting that comparable complex surgical procedures should be feasible on humans, if necessary, on long-duration spaceflight. Okay. There's extensive research being conducted on wound healing, and so on the Crew 4, they'll be launching a vessel up with live rat specimens to conduct now-time surgical analysis on those human tissue, or the tissue specimens. I'm sure most everyone's heard of NEMO, the NASA program. It conducts field tests in Earth-based environment, and so bringing people into that environment where they can be for weeks on time performing experiments is really a near microgravity environment that has been used extensively by NASA, and we've learned a great deal during our research findings in that realm as well. There's also, of course, a lot more to consider. Specifically, this slide speaks to potential telemedicine or telerobotics with surgery and windows where, when you're transiting to Mars, where you will not have connectivity for up to 20 minutes. And so obviously, if you're heavily reliant on reach back to a surgeon and back on Earth, and you have a 20-minute lapse, it's not going to work well. And so this slide just speaks to that gap and that concern with telemedicine for long-duration spaceflight. So you'll recognize this picture. Dr. Jones had it up previously. So in conclusion, I just state that it's an indisputable fact that a constant, whether it involves low Earth orbit or planetary exploration, is that space is an unforgiving environment and that it devalues the human body. For that reason, we as a species must be prepared for all possible medical scenarios and develop various surgical techniques and methodologies so that we can meet these challenges if humanity wishes to continue to explore and survive up in space. Thank you for your time.